When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Good evening. Welcome to Dr. Gor's show. Today we are going to talk about a topic which is in everybody's mind. Somebody or the other we know suffers from it. Common pain problems and how do we manage it. And to talk about this important topic, we have Dr. Samadev Datta in the studio. Welcome to Dr. Gor's show, Dr. Datta.
Thank you very much for having to invite me over to your show. I hope we'll have a good, productive evening this evening.
Absolutely. And Dr. Datta is one of very, very famous physician in New Jersey. He started his training in Mysore in India. He did his medical studies. Then he went to Chandigarh where he did anesthesia training. He went on to London and where he did his FRCA, Fellow of Royal College of Anesthesia. And then, of course, to widen his horizon, he came to United States. He did at prestigious Columbia University his residency in anesthesia, and he went on to do fellowship at Sloan Kettering, where he stayed there as an attending, and now he has his own pain management center in Hackensack, New Jersey. He's been chief of pain management at Holy Name Hospital. And above all, I think very, very important thing that he was honored by Government of India as Hind Ratan in 2011, where, as you can see in this picture, he received his award recently in January of 2012. So it's my esteemed honor to have you here and talk about this problem today. So let's talk about pain. You know, once in our lifetime, everybody feels some pain, headache, back pain, lower back pain, and you know, as an OB/GYN, I see pregnant patient always with some sort of pain, and that's, you know, all of us feel some pain in our back once in a while, and that's your specialty. You see everybody with some sort of pain. So tell me, what's your commonest complaint that patient come to you to see you?
The answer to that question, Dr. Gor, is that most people will have pain, like you said, sometime in their life, somewhere or the other.
Right.
Back and neck pain are the most common reasons why patients come to a physician. But pain as a symptom is the commonest symptom for which patients go to a physician.
Right.
In my practice, I am a physician who mainly specializes in chronic pain.
Okay.
I see people who have had pain for 3 to 6 months and above.
Right.
And those are the people whose pain processes after either surgery or, like you said, after obstetric cases and delivery haven't resolved, will then come to me.
All right.
So in the United States right now, we think that maybe about 50 million people are suffering from chronic pain.
That's a vast number.
It is a really big number. Now, it doesn't necessarily mean that all these 50 million people are seeking out treatment, but they do have pain, you know, occasionally. The people who are seeking out help are the ones for whom pain has incapacitated them.
Right.
And the goal in our pain management or in any other pain management field is to try and see whether we can control their pain adequately so that we can bring about functional improvement for them.
So it's their lifestyle, because it's affecting their day-to-day activity, and that's what you want to give them to go back to work, because I think, isn't it that one of the biggest number for disability in this country and is due to back pain related issues?
I mean, that is a topic that is actually very, very close to my heart, because I find that people who have back pain do seek out disability very frequently, and sometimes it gets to become a little gray.
Right.
And that is a topic that is quite different. But as regards the process of quality of life, which you made a mention about, pain by itself can affect the patient and his family, his or her family around in ways that are far more than will actually come across in an interview.
Right.
From the fact that they are not able to work, so they cannot earn money, so it decreases their quality of life because they don't have that money at home.
Right.
There is a whole friction that comes along because sometimes people have pain and others don't believe that they have pain.
Right.
Then it becomes a question of saying, do you believe what I have?
and the social situations
The
change.
social situation changes quite enormously.
Right.
A relationship between a husband and a wife will change because the husband might say, I have pain in my back. They're now not being sexually
Right.
active, and that really causes a lot of rift in the family.
And apart from that, I think the associated symptoms that can come, depression, which because of chronic pain is highly associated with depression, and also if they are not earning money, and all that psychological aspect is a huge impact.
This is exactly why the process of what we refer to as the biopsychosocial model is so important for us to keep in mind when we talk in terms of pain management.
Right.
So we talk in terms of there being a biological problem that
Sure.
causes the pain, and then what happens with the psychological issues that come along with that, and the social impact that this entire complex of the
Right.
biological and the psychological problems bring about. And so if a patient comes to me and has a pain issue, from having to initially be a physician who is trying to evaluate and take a history and find out what is the cause of pain, it is imperative for me to try and also ensure that the other aspects of pain
Right.
have not been missed out.
Right.
I mean, in my practice, we have patients who are from 18 years of age till 100 years of age, and everybody has a different agenda, should I say, as far
Right.
as pain
Absolutely.
management goes. There are people who come to me who have back pain related to an injury at work, and they're trying very hard to get the most as they can.
Right.
And there are other people who have been stabbed in their neck, and they are now working very hard to maintain two jobs because they don't have a way to be able to get any other source of
Right.
money. They come on a wheelchair, they're maintaining two jobs, they're supporting their family, they're supporting their children, and they are doing what they're doing.
So you see the two different
Completely.
aspects. Somebody who is trying to maximize their disease and earn the max benefit, and while somebody might have a major problem, but they still want you to clear them so they can earn the job and get to work.
This is actually a big problem. So, this is something that is being addressed by the government bodies is to find out how and what we can do to be able to
Right.
help reduce that. But as coming back to the pain issues,
Sure.
the pain issues that we are what we try to do in pain is to find out, like we said, neck and back are the commonest reasons why patients have pain.
Okay.
So our goal initially when the patient comes to me and I do a history, I'm a little old-fashioned. I like to talk to my patients first, examine them, then look at the investigation.
That's what makes you a good physician. I think listening to patients, you get so much information.
Correct. I mean, I need to see the investigations, and I'm not against that, but I
Right.
need to first talk to them to find out what it is.
Exactly.
And it allows for me to be able to say, hey, listen, now I have some kind of an idea of what the patient is suffering from. When we examine a patient after we've done the history, it gives us a better idea of where the sources of pain are.
Correct.
Now, if we try and focus that neck and back pain being the biggest sources of pain, within the neck and the back, there are multiple sources of pain.
Okay.
If we just broadly classify them as pain that is coming from within the spine, the muscular structures, the ligaments, those
Right.
are all very broadly defined as what we are. Then within the spine, you have different structures within the spine which may cause pain,
Right. So we have a model here where we can.
which we have over here. Now, this is a very simple model of the spine.
Right.
And in the spine over here, you have different, what do you call, components to that. This is the back of the spine over here, and this is the front of the spine, which is towards the tummy. You have over here, you have the bone, you have the disc, and these are nerves.
Right.
Now, if you look in over here, this is what we refer to as a spinal canal,
Right.
and this is the spinal cord that actually connects to the brain.
Right.
The sources of pain that you have very, very grossly, what we all know about is spondylosis.
Right.
The spondylosis comes along when you have arthritis in this joint.
Joints.
This joint is the joint that moves, and when you have arthritis in that joint, we get spondylosis.
Right.
Commonly, spondylosis will cause us difficulty getting in and out of the chair. When you sit in a car for a long time and you want to try and get out of the car, you feel the pain.
Stiffness. Right.
The pain then is usually across the back. Sometimes the pain will radiate down into the back of the thigh towards the knee joint. That's all spondylosis.
Okay.
If you, on the other hand, have a disc herniation, if you see that there's a little red spot over there, that disc herniation can cause irritation to the nerves.
Right.
When you have irritation to the nerves, you will then complain of what is referred to as sciatica-like pain.
Correct.
That sciatica-like pain will go radiating down into your
Like
leg.
a sharp lightning pain.
Correct. And that pain can be very, very incapacitating.
Right.
So based on the age group of your patient that comes through, you could have a different symptom and a different cause of the pain process.
Right.
In addition to that, when you grow older, that's just a relative term, you know, I mean, I just kind of look at that over there. But what does happen is that the canal, which is the spinal canal, as we get arthritis, can become constricted.
Okay.
When you get constriction of the spinal canal, you will then have spinal stenosis.
Okay.
Spinal stenosis is actually very common. And it is interesting that as we grow older, the incidence of spinal stenosis becomes more and more. Spinal stenosis may have no pain when the patient is sitting, but when that elderly person is out there shopping, the person cannot shop because immediately as they start to walk, they start having pain. So a common process that these elderly patients will do is they will take a shopping cart and bend over so that they don't have to worry about keeping their spine straight and they don't have pain. And it is only when you question them as to when they have their pain will they tell you that this is when I have my pain, and when I go shopping I take a cart and I have no problems. That you realize that then the most likely cause of your pain is now spinal stenosis rather than a sciatica-like pain.
Correct.
So a sciatica-like pain now is quite a different process, because now that is a younger person who probably had a injury related to work or injury related to play, and you had a disc herniation, and now they just can't move their legs.
So in a short time, what we discussed, it was just related to spine.
Correct.
And so many things. And then we have the ligaments and the muscles and in neck and all that.
So let me just take one more moment over here, because in the back, we also have what is referred to as the sacroiliac joint.
Right.
This sacroiliac joint is where the spine meets the hip bone.
Right.
This joint over here is a joint that is very commonly neglected, because about 25% of all the back pain problems in the back are from the sacroiliac joint. And we tend to neglect that process.
Right.
The good thing about it is that if we are treating that properly, we can help the patients a huge amount. Now, when people have spine surgery and have lumbar fusion, 75% of the people who have had that will have problems in the sacroiliac joint. So it's a joint that we tend to ignore, but does cause a lot of problems.
Right. And I think that's usually, I think being an OBGYN, I always get to the point of obstetrics. I think our pain is usually in that area.
Correct.
Especially with pregnancy, the tailbone being more hypermobile, they have more pain over there. And also the joints, because the sciatic nerve gets displaced.
Absolutely
So I think I'm more concerned about the lower back, that we see it more often in my practice.
That is correct. And as you know, coming back to the issue of obstetrics and gynecology, one of the things that you see in your practice is endometriosis.
Correct.
Endometriosis is a cause of sciatica-like pain in my practice, because these patients will have deposits of the endometrial tissue, and when it irritates the sciatic nerve, they will have increased pain with their cycles.
Right, so and it's a menstrual cycle related monthly pain. And if you ask proper history, you'll be able to diagnose that.
Exactly right. And so in our practice, we refer to it as cyclical pain.
Exactly.
Now, cyclical pain is not going to be treated with doing epidural injections, because it doesn't matter what you do, that cyclical process, which is the irritation from the endometriosis, is not going away.
Right.
So you will then have to do whatever you need to try and control the endometriosis for me to be able to help the patient in any way.
Right.
So that comes back again to say, you need to take a good history and physical for us to start the day to find out which way we're going to go to.
Right.
Now, we were talking about the muscle pain, the muscles. Now, what we have found is that, and we know, is that there are big, strong muscles in the back which support the spine. There are also very strong muscles in the front of the spine which support it too. And it is important for us to understand that the structure of the spine and the integrity is maintained by the actual integrity of the muscle.
Okay.
So to keep the muscle in good shape is mandatory to be able to try and help keep the spine in a good structure. So when we have patients who come in and they tell me that they have a very sedentary lifestyle, the first thing you ask them is, do you exercise? And they will tell you no. You ask them, when I do my examination, I ask them to walk out along the corridor, and you can see how they walk. And I can see that they're all walking slouched over, really indicating that they have made no effort to try and exercise to keep themselves in a good shape.
Right.
So as part of the treatment process that we look at, that is all included over there.
Right.
Now, comes to the ligaments. As a country, we are all quite active in many sports. Now you will see that these people might have hurt themselves while in some kind of a sport process and have had an acute injury for some sort. That may, most of the time, that kind of an acute injury is not something that I will get to see. They will have gone to an orthopedic surgeon or, you know, a physiatrist, and they will be dealing with that. It's only when those processes do not resolve that they will come to me, and then we'll try and do something in a more chronic process.
Sure.
But that can add up to a lot of pain processes, which will then cause significant amount of discomfort for the patient.
Right.
So that's a very simple introduction to what it is over there as far as the back goes. In the neck, we have similar causes causing pain, and people now have been using the computers a lot. So you will see a lot of young people sitting across the computer, and a common position for them to sit over is to bend in front, and they will then extend their neck that way to look at the screen while they're typing on their keyboard. This is about the worst position that you can possibly have.
Wow.
Because it is really putting a lot of pressure on your neck.
Right.
A lot of pressure on your neck. So every time patients come to me and they have a neck pain process, I ask them what their job is. And if they're secretary sitting in an office and this is the position that they are working with, this is just not conducive for their pain. So one of the things I will tell them to do is to take good control of their posture, and then they can ergonomically try and raise the screen so that they're looking at the screen directly in front of them rather than having to bend down that way.
Right.
And that really doesn't help. Now, what you will find is a lot of people will have the spondylosis in their neck over there. And based on where the spondylosis happens, you could have spondylosis causing you have a headache.
Right.
And people will tell you, I have a migraine headache. But when you talk to them, they don't have any of the symptoms related to migraine, but they have the sharp shooting pain that goes to the back of the head.
Right.
And that is more than likely spondylosis in the neck causing occipital neuralgia.
Wow.
The treatment approach is totally different than what you would if you had migraine.
Exactly.
And so, again, the process of history and physical. People will have pain in the neck and the shoulder area. And this will then cause them to feel like they want to feel the muscles are getting very tight.
Right.
Because of the irritation in that neck over there.
Right.
So the entire, the start of any kind of a interview with a patient is to take a good history.
Right.
And then
I
we'll do a
think
physical
you
exam.
have highlighted it in such a beautiful way, the neck pain and the source. I think it's so easy to understand where the problem, can be, and that's why I think your expertise in this field is so important to kind of pinpoint where we go. I'm going to take a short break and we'll be right back, continuing with the examination and history. So stay tuned.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back to Dr. Gor Show. As you heard before, we're talking today about common pain and its management. And to talk about that, we have Dr. Samadev Datta with us. And so far we have talked about history, why listening to patients and getting the information out is so important, because that helps us diagnose a lot of problems even without doing any investigation. So something to take home message for all our viewers is to write down and keep a notice of when your pain comes, how many hours does it last, what makes it worse, what helps it get better. And those things are very important for us to kind of come to know where the source of this pain is. To continue with our discussion, Dr. Datta, as we were talking about the neck pain, the position, the kind of job somebody does is kind of, helps you to identify. And there might be simple measures, as you suggested, changing, the screen for the computer, changing maybe the position of your chair, and such simple measures can help you. Also, I hear about the pillows, position of the bed, like stiff, soft. What is there any consensus medically? What is a better way to?
I couldn't give you a exact quote from any kind of literature that is about the consensus, but will tell you this, that what has come across in the literature is that supporting the posture of the neck during sleep is conducive to allowing for decreased pain processes.
Okay.
So when they talk in terms of having to have a good pillow, if you have pain in the neck as being one of these symptoms, is actually quite important. And I will give you from my personal experience that I used to wake up in the morning sometimes and I used to feel my fingers get numb.
Right.
And out of sheer curiosity, I had taken an X-ray of my neck, and I see that I have a lot of arthritic changes in my neck. I have spondylosis. But being a pain doctor, I didn't go to another pain doctor.
Right.
But that's another issue. What I did was I changed my pillow recently.
Okay.
And by having to change my pillow, I have found out that I now wake up in the morning, I don't have any pain in the neck and shoulder area. My fingers are not numb. So of my own personal experience, I will tell you that changing and having the correct pillow, I think is actually going to be quite useful.
Right.
Now, everybody might have a different way that they feel comfortable with.
Sure.
So it might be a question of a little bit of trial and error before they find the pillow that suits them. That suits them. And if they find that that's a good pillow, my recommendation to you would be stay with it.
Right.
You might need a little bit of trial and error, but stay with it. And you will find that when you wake up in the morning and you don't have pain to start the day with, you will have a lot more energy. In my opinion, an investigation is done if I am looking at having to do an intervention.
Correct.
And if a patient comes and tells me that there is no intervention that they want done, then the question is, do I need to investigate to find out what the problem is?
Right.
So yes, you might want to do that and keep it in, keep a note of it all. But if the patient says they're not interested in finding out about it all, and so long as the pain is controlled, I'm quite okay to continue with that.
Right.
So of the investigations that we're looking at, a simple investigation is to do a plain X-ray of the spine and see if there's any problems. Just today at my work, I had a lady who has multiple myeloma, and she just had bent over to pick up a grocery bag, and she picked that up, and she felt a real bad pain. A plain X-ray showed that she had a compression fracture of her spine. So today I fixed that for her, but that was just a simple X-ray, and then of course we knew there was a compression fracture, so it went to the next step to find out whether there was an acute fracture or not, and it was. Now if somebody comes to you and has got this pain that's radiating into the arm or into the leg, the same thing, you would then consider doing a more detailed investigation like an MRI. Now an MRI is actually very, very detailed. Some patients cannot have an MRI, like if you've got a pacemaker. I mean, there are a lot of elderly patients who come to me and they have a pacemaker in place, in which case an MRI cannot be done.
Sure.
We would then just do a straight CAT scan or a CT scan, and a CT scan is actually quite detailed and actually quite adequate for what we need to do. If at that time, after I've done the physical examination and do a CAT scan or an MRI, and the relationship between the patient's symptoms and investigations correlate, then I can say, yes, I know what's happening over there.
Correct.
Now, there is a caveat that I wish to bring about in this interview, is that 70% of people who have a disc herniation do not know they have a disc herniation.
Right.
Of the people who have a disc herniation and have pain, it's quite important. So most people don't know they have a disc herniation. So having a disc herniation means
can
nothing.
be asymptomatic. Completely. It can be there for.
Of the people who are symptomatic from a disc herniation, 90% of those people do not require anything done.
Right.
They will require conservative measures like physical therapy, maybe a non-steroidal anti-inflammatory, maybe a muscle relaxant, exercise, weight loss, posture will more than likely take care of the pain. Less than 10% of the people who have a disc herniation and are symptomatic will go on to interventions in pain management, which we will discuss in the next part. And only less than 1% of those people will need surgery.
So it narrows the field so.
Very much more. So if you as a patient have a pain problem and you say to yourself, the likelihood of my needing surgery is very minimal, you should now feel at ease and not panic that just because you've got a back pain, you're going to require surgery. The likelihood is very little.
And I think that's a very important point, because a lot of times the patients don't want to go to a physician because they say, oh my God, he's going to say I'll need surgery for my disc herniation. I don't have time. Why bother to go, because I'm not going to do it. But I think that's a very important point you brought up. It's very, very uncommon that you're going to need surgery. It's less than 1%, as you mentioned.
Of the people who are symptomatic.
Correct. So I think it's a very good topic that we discussed, because I think a lot of time, especially I think I've seen more Asians and Indians, we kind of don't want to do surgery. We would do anything but surgery. So don't hesitate, at least find out why you have the back pain and go and see the physician.
And I think if you have the ability to see a physician, it is good to do that.
Absolutely.
But I would recommend that if you have a back pain process, you must do a little bit of investigation for yourself to find out, like you mentioned earlier, as to what causes the pain, what helps to relieve the pain, how often does it come. And if you come with that history to the doctor, to me, if I'm a pain management physician, or to anybody else, it will help them guide you through the process of saying, hey, this is what your problem is, this is what you need to do, and if that doesn't get better, we will go the next step.
Right.
And it is really a two-way process between what you as a patient come to me with and me as a physician can provide you with, to help guide you, the patient, to the best possible direction.
And I think that's the whole idea of this program, to educate all our viewers so they become educated patient, and an educated patient, it helps us as a physician to make a nice treatment and help them correctly, because we know then what we are looking and what we are treating.
Correct. And and I tell all my patients this, I said that if you come with the knowledge, I can talk to you at a level that is much more higher than if you came without the knowledge.
Correct.
Because then I have to explain things at your level, which I can understand, I can do that, but you may find it a little bit difficult. So it's really, for me, it's an educated patient is a much easier process to work with than somebody who's not willing to learn from me over there.
Correct.
So now, some further investigations that are taken into consideration when we do over here is if somebody's having sciatica-like pain, they will occasionally require for what are called as EMG,
nerve conduction.
Nerve conduction studies over there. Nerve conduction studies are done quite frequently, and it essentially is to try and identify if that nerve is in any way traumatized, and is there any kind of decrease in function.
Sure.
When you see decrease in function for the nerve, it becomes an urgent process for you to intervene, because a nerve function that is completely gone and a dead nerve is not going to recover,
come back.
and you don't want that to happen.
So any compression, you want to relieve it early before the permanent damage happens.
Correct. And that is important, because when you go to the physician and you tell them, if you come to a physician and you tell them that you've become incontinent of bladder and bowel, that's urgent.
Correct.
No playtime. You have to go to surgery.
Right.
And that's important for us to understand all these things over there.
Right. So I think we've so far understood about the mechanism, maybe pathophysiology of back and neck pain and causes, and why the history is important, why investigations we do, and for what we do. So with all this knowledge, I want you guys to think about it and wait for next month's show, and we're going to talk about how to take care of it. If you have any friends or family members whom you think suffers from pain, which is, kind of affecting their life, Dr. Datta is not far. He's in New Jersey, and you can always tell them to watch this show on YouTube, called www.youtube.com, and click on Dr. Gor's show, and you'll be able to view this program again and again. Have a good night, and till next time.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.